Sudden cardiac death represents a major worldwide public health problem, accounting for 15 to 20% of all deaths. In fact, approximately 90% of people who experience a sudden cardiac arrest, or SCA, do not survive. However, an SCA victim's chances of survival can dramatically increase if they are given a life-saving shock from a defibrillator as soon as possible after the SCA begins. The G3 Elite Automated External Defibrillator is the latest AED in the G3 series from Cardiac Science and is a powerful solution to help improve the chances that an SCA victim will survive. The G3 Elite makes conducting a rescue easy, even for less experienced rescuers, and its advanced technology ensures that SCA victims receive fast, effective therapy to help maximize their chances of survival. Let's go through the steps of a rescue to demonstrate some of the G3 Elite's key features. The G3 Elite automatically powers on as soon as the lid is opened. The rescuer doesn't have to find a power button to start the G3 Elite, and this helps ensure a fast start to the rescue.
Stay calm. Follow these voice instructions. Make sure emergency services are called now.
The G3 Elite uses a proven program called Rescue Coach to help people of all skill levels through the entire rescue process quickly and accurately.
Begin by exposing patient's bare chest and torso. Remove or cut clothing if needed. When patient's chest and torso are exposed, remove square foil package from lid of AED.
The G3 Elite gives rescuers easy instructions for fast placement of electrodes on the patient's chest. To make the job easier, the G3 Elite features non-polarized pads. This means the electrodes can be placed on either position of the chest to help minimize rescuer confusion and maximize speed. Not all AEDs have this important feature. When the electrodes are placed, the G3 Elite immediately begins analyzing the patient's heart rhythm.
Do not touch patient. Analyzing heart rhythm. Please wait.
The G3 Elite features a proven proprietary algorithm called Rhythm X. This advanced program analyzes the patient's heart rhythm using a series of complex measurements to determine if a shock is required. Not all heart issues require a shock, and Rhythm X ensures no shock will ever be delivered to a patient who does not need one. If a shock is required, the G3 Elite's proprietary STAR biphasic program quickly analyzes the patient's impedance, that is, the resistance to electrical current in the patient's torso. Every patient's impedance is different, so STAR customizes the amount of energy delivered to ensure the best therapy.
Preparing shock. Move away from the patient. Shock will be delivered in 3, 2, 1. Shock delivered.
After delivering a shock, the G3 Elite uses Rhythm X to assess the patient's heart rhythm again and determine if a subsequent shock is required. If so, the G3 Elite again employs its STAR biphasic technology, which escalates energy to the patient. When hospitals and ambulance services use advanced manual defibrillators and subsequent shocks are required, a greater dose of energy is generally used to help achieve a favourable outcome when appropriate. The G3 Elite follows the same principle. It automatically increases energy if a second shock is required, and increases energy again if a third shock is required. Not all AEDs have this important feature.
It is now safe to touch the patient. When instructed, give patient 30 rapid compressions, then give 2 breaths.
The G3 Elite also helps rescuers of all skill levels perform CPR. First, the G3 Elite provides easy-to-follow instructions on hand placement.
Place heel of one hand on center of chest between nipples. Place heel of other hand directly on top of first hand.
Then, the G3 Elite provides simple instructions to help rescuers perform correct CPR.
Lean over patient with elbows straight. Press the patient's chest down rapidly, 1/3 depth of chest, then release. Start CPR.
The G3 Elite has several other features to make rescues simple and effective. Voice prompts that direct the rescue are also shown on an easy-to-read backlit text display. When the G3 Elite is stored, it conducts an in-depth series of self-tests every day to ensure its battery, non-polarized pads, and critical circuitry are rescue-ready. It is important to note that the G3 Elite tests not only for presence, that is, that the components are plugged in correctly, but also that all components are functional. This means that the G3 Elite sends a current through the electrodes every day to ensure they still conduct electrical current and can deliver a shock if required. It's a highly important test, considering the gel adhesive on common AED defibrillation pads can dry out over time or become ineffective due to other issues, such as the package being inadvertently torn or opened. Not all AEDs have this important feature, and many other AEDs test as infrequently as once a week. The Powerheart G3 Elite from Cardiac Science is the next generation in the legendary G3 AED series. It delivers effective therapy for SCA victims, ease of use for rescuers, and self-tests to ensure rescue readiness, so AED owners can have confidence in their programs. To learn more, visit our website at www.cardiacscience.co.uk or contact your nearest cardiac science dealer.